When your sinuses are all swollen, you can't smell things as easily. I've had difficulty sleeping because I'll end up breathing through my mouth and then snoring, and my husband complains. Even kissing my husband, because you can't kiss without being able to breathe through your nose.
Well, Ms. Burchett is a real good example of someone who has chronic sinusitis. But what I was able to do back about 10 years ago, and then again just here recently, using these modern minimally invasive techniques, was get her polyps and sinuses cleared out, get her infection cleared out in a way that gave her a very, very minimum amount of pain and suffering.
It wasn't going to clear up on itself. I had to do it. I had to get this done, or else I would never feel good.
I don't have to break their nose or pack their nose. They're not going to swell up and turn black and blue. It's not magic. But again, it's nothing like what they may have had themselves in the past.
I guess he has a new instrument now that can, he calls it like a GPS for the sinus surgery, where he can really get the instrument up there without it being a danger to the rest of the.
One of the things that's changed a lot in the last 10 years is our ability to get up into the sinuses and get polyps and infection out without disrupting the lining of the sinuses. And there have been many steps in that direction. The balloon is the latest step that lets you very delicately thread a catheter up into the sinuses, and then the blocked up pathway into the sinus you dilate open with the balloon. Then you're able to put another catheter up in there to rinse infection out. You can also put a little stent up through that opening that secretes a medication for a couple weeks to help things heal better and quicker. Certainly not a panacea, it's not a miracle cure, but in many cases, particularly difficult cases, it's very, very helpful for getting up into blocked up sinuses delicately and getting them cleared out.
The surgery that Dr. Wyatt did has it's corrected my sinuses to where I can breathe through my nose and I can take deep breaths through my nose.
Because most of the people that I see, I can help. Most of the time, the people who come to me, they come to me with a problem that I can either fix or help dramatically. I do it, and it's very satisfying.